Welcome to the GBTA Mid-Year Summit and Annual Business Meeting. This session will cover the annual business meeting and the election results. A few housekeeping notes. The registrant microphones and videos will not be enabled. Please place your questions in the Q&A box. These will be answered if time permits or potentially after the webinar via email. Feel free to use the chat. And don't forget to visit the supplier showcase and meet now with the sponsors. Remember to keep your event hub handy because that's the gateway to all of the different sessions today. Now it is my honor to introduce Suzanne Newfing, GBTA's CEO. Suzanne.
Thank you, Lisa. Hello, everyone. It's my pleasure to welcome you to the GBTA Mid-Year Summit and Annual Business Meeting. This marks another milestone as we all navigate the way forward. Since the last annual general meeting in December with Dave Hilfman, a lot has taken place. Our industry, travelers, programs, and world continue to change, and we do too. We're seeing more progress on business travel's road to recovery, but that path won't be as straight a line as we would like. Yet, our latest research shows another 12% of buyer companies this month, now 40%, have reopened policies for at least some non-essential travel. Today, we'll be sharing insights and updates on what we've been up to and what you've said is important to you. We're excited to create the future together. So let's get started. So it's hard to believe that I've been at GBTA for nearly 5 months. On joining, I laid out a 3-point plan of what I needed to do to succeed in this role on behalf of all of you. To listen, to rebuild your confidence in our association, and to create the building blocks and policies and actions related to industry recovery. On listening, my virtual tour for the first few weeks included often 10 to 12 hours of meetings a day with staff, members, board leaders, and council members, buyers, suppliers, partners, and volunteers across every region. Thank you for all of your helpful conversations and comments. On rebuilding our association, we are on our way to ensuring we have a solid foundation to see us through the pandemic and support members as we navigate the return to business travel. 2 foundational projects stand out where volunteers worked especially tirelessly, tongue-tied here, to reshape the organization, and I'll highlight them first. First, the Bylaws Task Force conducted a full review of the bylaws, which then went through 2 member votes, and in the end, overhauled the way we select and vote on board members. This now includes allied and direct members having an equal vote, and the addition of new regional positions to ensure we have global representation on the board. 27 volunteers managed this incredible amount of work over the course of 1,600 human hours over several weeks. A special thanks to Rita Visser and Will Pinnell for taking the lead on this very important initiative for the association. Another crucial activity was Project Unite, which looked at the integration of ACT and how best to merge those assets which GBTA acquired. We had over 85 volunteers work with us on this, and they put in over 1,300 human hours across 5 regions. Many thanks to Crystal Johnson and Greeley Cook for leading this effort. Throughout my relatively short time in this role, we have continued to engage with members and host a number of virtual events and programs. Some highlights include the Ready Safe Travel Summit, the Win It Awards Gala, the U.S. National Security Roundtable, the Ladders Program, the Sustainability Collaboratory, dozens of chapter meetings, committee meetings, and many regional town halls. We have touched over 10,000 participants in nearly 70 events in just the first half of this year, including many non-GBTA events in the industry. The Ready Safe Travel training program deserves a special mention as nearly 700 of you participated and almost 600 successfully became Ready Safe Travel specialists. It was our first truly global initiative bringing together members from around the world in real time with both global and regionalized content. At the beginning of the pandemic, we offered honorary memberships to those who were furloughed or laid off from jobs. 800 of you took us up on that offer. Since the beginning of this year, we are encouraged that new and renewing member numbers continue to rise. Regarding our academy, in the past 6 months, We have given out 132 scholarships valued at over $80,000, and there are more scholarships still available for members to take advantage. And our research team has completed nearly 24 coronavirus polls that started back in February 2020, giving voice to more than 20,000 poll respondents. These particular poll results are quoted and used in many publications and dashboards around the world. Now, I think we're on the media slide. In terms of building awareness, GBTA has had more than 1,900 media hits in the first half of 2021. Key publications which have included our data and insights are the important travel trades whom we know so well, plus mainstream media including the Financial Times, the New York Times, and CNN Online, and even some broadcast TV and radio. Members, sponsors, and media are increasingly visiting our online websites, properties for insights across various things, and our daily news briefs touch nearly 100,000 of you, and we are continually improving and working to build our relevance with followers on social media channels. Why GBTA's visibility is important especially is evident when it comes to advocacy efforts on behalf of our industry. And since the start of COVID, GBTA has been advocating for this industry. In the early months, we focused on financial lifelines for the industry and its employees. Our efforts in the US, for example, helped secure over $65 billion in emergency funding and regulations that aided the business travel industry. As 2021 began, we shifted our focus to reopening international travel. We have drafted, signed, and delivered 16 letters to the EU, British, US, and Canadian governments. We have on average conducted 3 meetings a week with elected officials and staff, including the EU Deputy Ambassador to the US, the UK All-Party Parliamentarian Group, the UN Ambassador on Travel and Tourism, and the Biden administration's COVID task force, discussing the importance of business travel, the difference from tourism, and the need to improve international passenger facilitation during recovery for business. We have kept our global focus as we have had joint meetings with our partners in Germany, Sweden, the UK, and others, as well as their government representatives. We were also a part of the effort to push the EU to accept digital health passports from other EU countries. And as we continue our drive for the US to end its international inbound travel ban, we recently delivered letters to the Trudeau and Biden administrations signed by nearly 600 GBTA-affiliated professionals calling for a framework to reopen that border. We were pleased to see yesterday's announcement by the Trudeau government that as of August 9th, fully vaccinated Americans will be able to enter Canada, and in September, other international vaccinated travelers as well. There are many more issues which we as an international community need to address. We will continue our push, but we need your continued support. So please fill out those surveys, which we are getting better at making shorter, because we pass this information along to domestic and international policymakers. Your voice is reaching the highest levels of business and political bodies. And when we request your help, please send those emails and place those calls to your elected officials. We will not stop pushing and speaking up on behalf of our industry and our members to open borders and get business travel back safely and effectively. Now, as our advocacy efforts extend to you, our members, I'd also like to point out some progress there. More than ever before, my team, the board, and I are focusing on transparency and sharing more information than ever with you. My team and I are making data-driven decisions and sharing that data with you so that you can understand why we do certain things, such as changing the date of our annual convention. I hope you too can see good changes in the works and will continue to have confidence in GBTA moving forward. I'm confident myself and excited that as we enter into the second half of 2021, we can confidently move into the pandemic recovery phase. In that light, we have a number of events and initiatives that I'd like to point out that you can look forward to. First, Ready Safe Travel training program in a self-paced online format launches today for anyone who wasn't able to participate in that live session in May. Next, across the fall and early winter, we have many more things on the calendar. Our collaboratory series continues on September and October on the road to convention, covering traveler well-being, the future of work, DEI, and meetings and events, all topics we will expand on at November's convention. In September, we have the GBTA Masterclass in France. This will be our first in-person conference in many months. On October 7th, we will hold the Mexico Virtual Summit. At the end of October, we'll hold a 4-city-based Ready Safe Travel workshop series in Canada. And of course, GBTA's annual convention is set for November 17th through the 19th in Orlando, Florida. And for the first time ever, will be hybrid, in person for those who can join us for the richest interaction and education, with a virtual component for those who can't. Our Italy conference will also be in November, with dates coming soon. And finally, we round out the year on December 6th through the 8th with our EMEA conference in person, in partnership with VDR in Berlin, Germany. But the education doesn't stop there. GBTA Academy has a busy second half of 2021 planned for you. Within the Global Leadership Program, or GLP, the Core Competency Finance course is happening this week, and the Core Competency Management course is happening in December. It's not too late to sign up. Core courses also continue: Fundamentals in Business Travel Management in September, Fundamentals of Strategic Meetings Management in October, and Advanced Principles of Business Travel Management in November. The Certificate in Corporate Travel Execution, or CCTE, just recently relaunched, and runs from September through December. And the Global Travel Professional, or GTP certification exam starts in October. It's a full schedule of education for this industry. And as we move toward the end of the year, we will be developing the 2022 strategy to ensure we continue to drive engagement across all areas of our association. So now on to an overview of our finances. As of December 31st, 2020, GBTA's assets equated to $13.2 million and liabilities at $14.9 million, resulting in a net asset loss of $1.7 million due to the fact that we had to postpone or cancel the majority of our events in 2020 because of the pandemic. Compared to 2019's assets of $12.8 million, 2020 assets of $13.2 million continues to be strong and stable as we are maintaining a strong cash balance and continue to maintain over $5 million in our reserves. Liabilities, however, increased by $8 million versus 2019. And again, since we canceled our annual 2020 convention, the deferred revenue balance, which is primarily the cash received from the canceled convention, carried over as a liability into 2021. 2020 revenue was $8.7 million, and 2020 expenses were $16.4 million. The expected loss is due to the lack of events and cancellation of the 2020 annual conference. However, as we maintain our assets with a strong cash balance and strong liquidity, we are optimistic for the future as the travel industry begins to rebound, corporate travel rebounds, and events in general begin to bounce back. Now, on this same slide regarding membership, clearly we had several crises which caused a decline in our membership numbers from this period in 2019 to this period in 2020. The pandemic, the consolidation and elimination of roles within the corporate travel industry, and the lack of convention all affected the 2020 membership numbers. Now, what a remarkable few months we have had. GBTA members worked together to put forth a series of changes to the association. Next slide, please. You passed overwhelmingly a series of changes to our governance and to the makeup of the board of directors. And with an unprecedented 24 candidates running for 2021 board seats, we further challenged all of you eligible members to more actively participate in the vote. Today, we're celebrating an historic turnout with 29% of eligible members voting. Thank you very much. And now it's time to announce the 2021 board election results. And if we had a virtual drum roll, I would have that going right now. So here we go. Winning the officer seat of president is Denise Trousseau, CCTE GTP, Global Travel Manager of PayPal, based in the United States. Winning the officer seat of vice president is Mark Kusheri, Executive Director, Global Head of Travel, UBS, based in the United Kingdom. Winning the Canadian Direct Regional seat is Charlene Ketwaru Nanu, Category Manager, Travel at Rogers Communications, based in Canada, of course. Winning the European Direct Regional seat is Jens Liltorp, CCTE GLP, Manager of Global Travel and Meetings at Leo Pharma, based in Denmark. Winning the Open Direct at-large seat is Mick Lee, Managing Director, Head of Corporate Services, Travel and Events at BNY Mellon, based in the United States. Winning one of 3 Open Allied at-large seats is Allison Taylor, Chief Customer Officer at American Airlines, based in the United States. Winning another of those 3 Open Allied seats is Will Pennell, Vice President, Digital and Product Strategy at BCD Travel, based in the US. And winning the 3rd Allied at-large seat is Maria Chevalier, EVP, Customer Success at PredictX, based in the US as well. And last but not least, elected president by the U.S. Chapter President's Council and representing the U.S. on the board of directors is Rosemary Maloney, Global Travel Manager at Sprinkler, based in the United States, of course. So next slide, please. Congratulations. I look forward to welcoming all of you and working with this esteemed group of GBTA volunteer leaders. And thank you to all who ran for board seats, all who campaigned, and all who voted. So I can't conclude this meeting without saying a special thank you to the GBTA team who welcomed me so wholeheartedly into my role and have worked tirelessly to help execute all of these association changes and initiatives. So that concludes the GBTA 2021 annual business meeting. Thank you for your kind attention. Now, next slide, please. Next on to our general session, which is the crux of what we plan to bring you in our virtual summit, On the Road to Recovery. A special thank you to United Airlines, next slide please, for sponsoring this session. And I'm very glad and honored to welcome Doreen Burse, SVP of Worldwide Sales from United Airlines.
Hello everyone, and welcome to the GBTA Annual Meeting and Mid-Year Summit. I'm so happy you all could join, and I know that this time together will be valuable as we look towards the post-pandemic future. My name is Doreen Burse, and I'm the Senior Vice President of Worldwide Sales at United Airlines. Even during the most difficult of years, at United, we're continuing our mission of connecting people and uniting the world. Travel looks a little differently these days, but we're putting health and safety at the forefront of every customer's journey. One major change we made as a result of the pandemic was to reimagine our health and safety protocols with the launch of United's Clean Plus. But we're not stopping there. We're making travel better and easier with innovations like our Travel Ready Center, a one-stop shop digital assistant that allows customers to manage entry requirements in different destinations, find places to get tests, and upload their documents to be ready for travel. Simply put, we're taking the stress out of the process as your travelers return to face-to-face interaction. Additionally, we're looking to the future of air travel as we've recently made a huge investment in our fleet. And that's with the purchase agreements for 270 new mainline aircraft and updating our current aircraft. These new planes, as well as all of our retrofitted narrow-body aircraft, will feature more premium cabin seats, the industry's fastest in-flight Wi-Fi, and overhead bin space for every carry-on bag and more. As the world continues to open, we're continuing to lead with a committed focus on improving your travelers' experience every time they fly with us. Throughout the pandemic, we've learned a lot about resilience, and we're channeling that strength into an effort you all know well, that is getting back to business. Never before has our company goal of connecting people and uniting the world been so relevant. Thank you for your time today, and we look forward to welcoming you on board soon.
Thank you so much, Doreen, and thank you to United Airlines for your sponsorship today. Next, I'd like to introduce our next speakers, Dr. Alan Dow, a tenured professor of medicine and health administration at Virginia Commonwealth University, and Scott Wayne, who is a partner and founder at Envoy and Canvas Studios. They're going to share some perspectives around the psychological impacts of the pandemic and what might help alleviate some of the anxiety for travelers as the world reopens. Over to you, Dr. Dow and Scott.
Clap away.
Are we calling this take 3 now?
Take 3.
GBTA, take 3.
Hello GBTA, I'm Scott Wayne and I am here with Professor Dr. Alan Dow. Really, how many titles can you have?
That's funny.
And actually, while we're on that, you've just come back from rounds at the hospital. You're wearing a stethoscope. Do you guys actually use these things anymore?
Well, it's a kind of symbolic totem, but yes.
Yeah, it's like a necklace you all carry around just to let people know that you're super smart. Okay, so we're going to do an update on COVID and more importantly, how it's psychologically affecting some of us around the world. But first of all, just give us a little bit of your background. What do you do?
Yeah, so I call myself a general internist, so I take care of adults who have all sorts of problems, and then I do a lot of education. So I work with students, I work with residents, and a lot of what I do is actually trying to educate other healthcare practitioners about how to take better care of the patients that they care for.
So you are not an epidemiologist, you are taking that, you're translating that deep expertise about viruses and then translating it to the health community to respond to this public health crisis.
Exactly,
Okay.
yeah, and we've done 96 webinars over the pandemic to talk about all sorts of different health topics related to COVID.
All right, so are you traveling?
I am starting to travel.
And how do you feel when you travel?
I feel good. So I'm vaccinated, and I think as long as you're vaccinated, it's safe to travel. So, you know, it's okay to be out there.
Domestically and internationally?
Yeah, I mean, there are a few spots in the world that are having bigger surges right now. So a few parts of South America, Africa, but it's really developing countries where it's been harder to get the vaccine out. I mean, the real story is that the vaccine has been a tremendous success story for controlling the pandemic.
So the vaccines are working? All the vaccines are working?
Yeah, well, so I do think that the Moderna and the Pfizer, the two-dose ones, are a little bit better than the other ones. But, you know, I mean...
You're talking about a few percentage points.
Yeah. J&J is also a good vaccine. So.
Okay. There is AstraZeneca for the rest of the world.
Yeah.
You know, that British-made one.
Yeah.
Swedish, British, whatever. Almost all invented by women, we should point out, as two men talk about this crisis.
Yeah, and immigrant scientists, too. So it's amazing to sort of think about what the future of science looks like. It's actually pretty exciting. I've talked to my daughter about this.
Yeah, it's good role models. Okay, so you're happy to travel. Now, we haven't touched on, if you're not vaccinated, what about travel within the United States?
Yeah, so the U.S. is really a microcosm of the world, and that those places where there are lower vaccination rates, where you're seeing more cases, tend to be more rural, and so there's a lot of rural hospitals that are still struggling with the COVID volume. But my hospital in downtown Richmond, Virginia, we're down to about 10 cases in the hospital at a time, which is much lower than the 130 we had in the winter.
And this is a big urban health system that you're on.
Yeah. So it's really a success story of the vaccine and the pandemic.
But you're connected to your network internationally of your counterparts around the world working in health environments. What is explaining the difference in health policy, especially around borders, for these countries that have similar demographic profiles but are making very different choices? Don't be diplomatic here.
Yeah, well, it's politics. A lot of it is what's driving this, is that, you know, trying to navigate those different politics in you know, most of these democracies and sort of how that fits in with other sort of political agendas. If you look at the World Health Organization and the CDC, they haven't been perfect. They've probably been a little slow to make some adjustments from time to time, but it's been pretty consistent in terms of what they're saying about things, and it's not always what they're saying and certainly what the evidence says that has driven national policies, including in the U.S.
So if it's breaking some of our minds that we have matching vaccination rates in different countries but the borders aren't open, we're not going crazy for looking at those numbers and wondering why they're not open.
It's just like economic policy and social policy, all these other things that we have that are, you know, when you get politics involved, it gets messy.
Yeah, okay. All right, so given that, and given that most of our audience today are working somewhere within the business travel sector, they're either guiding business travelers themselves because they're a corporate buyer of travel, or they're providing services, whether it's a hotel, an airline, ground transportation, cruise ships. What is the I don't know, the question here, like, where are people's heads at?
Oh.
So we've covered like the public health, but how should we be dealing with people psychologically and as human beings?
Yeah, well, so that's a great question. I think that is the key question now, is how do we get past this? Because we know that, for example, during the pandemic, screening rates for colon cancer, breast cancer, things like that really fell down. Primary care visits really fell down. There's a real decrease. And so that's sort of the health challenge that we're dealing with, much more than the pandemic. And I think behind that is the psychology that we've all had very different pandemic experiences, and how we are emerging from this is different. And so, you know, you've read things about people at concerts or at sporting events or on airplanes that are sort of just misbehaving at restaurants. And I think that's really a factor of some of us have forgotten how to interact with each other. And I worry about what that means for us socially as we try to sort of reknit that fabric of how to behave together.
So this is anecdotal. I've traveled throughout the pandemic, and the nature of the work that we do. But I've observed that there seems to be like a few categories of people traveling right now. Those that have been sort of in stable jobs, they've been trapped at home in their middle class existences, dare I say it, frustrated that their exercise bike didn't arrive in time. And there's almost like unleashing. There's all this pent up demand and they want this premium experience. And they're in those, probably including those in the industry itself, who've been furloughed, their business has been harmed, their careers have been at risk. They're almost in this sort of punch-drunk state of recovery. And then, of course, there are those in the midst of the crisis that are sort of in there or have been affected directly by it. I mean, that's just 4, but it strikes me there could be a dozen categories of experiences, and how does one know?
Yeah, that's a very astute observation, a good way to think about it, because really the range of our experiences in the pandemic, whether we've been grieving or whether we've been bored or whether we felt grateful, however that is, it's going to manifest in different ways as we go out. And we really have to give each other a lot of grace and a lot of patience as we get through this, and also hope that people around us, behave appropriately.
Yeah, I've seen you do trainings with physicians around making sure you know where people are before you give them any advice or counsel. Will you just run through that, and is that applicable for people working in the travel industry today against that backdrop?
Yeah, well, so I think it's fundamental for communication. I use this with my kids and my spouse to give you any sense of the usefulness of it.
Me.
And my parents, it's the same kind of thing. And that is, before you give someone information, you want to know what their perception of what's going on in the situation is, because that's going to drive the information that you give them. And so if they have a certain picture of what a situation's like, the information you're going to give them is going to be very different than if they have a different perception of what's going on. And so I started using it with patients when I first learned about it. And it's like, tell me what's going on with your disease, tell me what you understand. And as I understand the health condition, then I can give them information that makes sense.
You'll calibrate that response.
Exactly. And it really, what we're talking about is a way to take the concept of empathy into some very teachable skills, which we've taught with students and residents and doctors, as you've seen. But I think it's really relevant for anything. If I have to tell my wife that I'm going to be home late from work because I'm busy at the hospital, I really need to understand what's going on in her life before I give her that news. Because if she's having an awful day and I'm like, I'm going to be late home from work, that's not going to go well. But if she's like, things are going okay at home, and I tell her that, she's gonna understand that. And so I'm going to get a very different response depending on what's going on, just as a quick example. And so I think that's key for all of us, is to understand where that person is coming from.
So doing the best that we can to, first of all, level set with what people's experience has been, and then we'll almost intuitively know how to communicate with them.
Yeah. And I see why you're bringing this up, because, if you're a travel planner or something like that, with all the different experiences that people have had and have been through, you're going to be dealing with all sorts of different perspectives people are bringing to travel, people that are confident about it, people that are excited, people that are terrified, our different risk tolerance and how we think about things. It really is going to be a very interesting time as we sort of reemerge back into society.
So one thing for the whole industry to do is just pause, check where the audience is, and then communicate.
Yeah.
My last question for you, if one of those members of the traveling public that you happen to interact with is a member of the healthcare community, a doctor, a nurse, a social worker, or a spouse of, what should be the first things we say to them as we're traveling again?
Oh, wow. That's a great question. Yeah, so, over the past 16 months, my colleagues faced a situation of uncertainty where the risk of death just sort of felt imminent, and seeing people die, we see people die all the time, but it was different, it was uncertain, we were terrified for ourselves. Vaccination really changed that. And in the beginning, there was a lot of shows of gratitude for healthcare practitioners, which we appreciated, certainly. But it would be great to just sort of say thanks for getting through this. They're in a sense veterans of a war that was, fought inside of hospitals and not on battlefields. And just like we should thank our veterans, it would be great to give them just a thanks for doing what you did.
That's great. Professor Allendale, thanks so much. And I know you're traveling tomorrow. Have a great trip and a great vacation.
Thank you for having me here to talk.
Hello. The next session is On the Road to Recovery. Our speakers are Annette Cumming, Vice President, Channel Sales of Deem, and Greg Land, Distinguished Industry Leader, Travel and Transportation, IBM. Over to you.
Thank you so much, Lisa, for the introduction. On behalf of Greg and myself, it's such an honor to be speaking with all of you today. We heard Scott and Dr. Dow speak to some of the psychological challenges travelers are facing as they get back on the road. Over the next 20 minutes, we're going to continue that road to recovery discussion and explore how our industry can leverage technology to help travelers feel more comfortable as they maneuver the new experience of business travel. Hi, Greg. It's great to see you.
Morning.
Good morning. All right, let's jump right in. I understand that IBM does a lot of research work. What are you seeing relative to the return to business travel?
Yeah, thank you, Annette. And we do research both with travel suppliers as well as with the traveler themselves to keep our finger on the pulse of what the consumer expectations are. And much like everybody else has seen, we all know that leisure travel is coming back first. But one of the recent surveys we did, we specifically focused on business travel. And we looked at perceptions of travelers both before they were vaccinated and after they were vaccinated. And we surveyed 15,000 travelers across 9 different countries. And we saw significant swings in their perceptions of how they felt and how comfortable they were traveling for business before they were vaccinated and after they were vaccinated. And in all 9 countries that we surveyed people, we saw swings of 15 to 20 percentage points of where they were much more comfortable traveling after they were vaccinated. So much like what Dr. Dow just talked about, I think having the vaccination makes you feel a little more comfortable getting out there and being amongst people at an airport or at a business meeting. And I know at IBM, we're reopening our offices on September 7th here in the US. That's going to be a trigger point for us to also get back out and travel more so for business as well.
That's wonderful and amazing stats. What a swing over that time period. So if we think about travelers getting back on the road and just in general, things opening up, for the community at large attending this meeting, I'd like to take a focus on technology. So what do you see as being important to support the business travel community and travelers?
Over the past years, we've been working with all of our travel and transportation clients. There are several technologies that have definitely floated to the top as far as what really is needed to get from that crisis point to really thinking about recovery and reinstilling the trust of the traveler. Probably the first technology that really bubbled to the top of the list was contactless. We saw this in food and beverage. We saw this in retail. It applies as well to travel. For the traveler to feel very comfortable, they don't want to have to touch a bunch of paper. They don't want to have to interact too much with other folks or even touch a kiosk. So as much as they can do everything through their own phone that they've sanitized that morning and has been in their possession, that's really what we're seeing. So contactless capabilities floated to the top very quickly. Second is call center technologies and really starting to infuse AI into call center technologies. Both at the beginning of the pandemic as well as throughout the recovery process, we've seen huge call center bottlenecks. And it's not just because of reduced staff. It's because you have more and more callers that are calling in confused about what to expect when they travel, not sure what documentation they need to have or what capabilities they need to have access to on their phone. So now as people are getting out and starting to travel again, we're seeing those bottlenecks again, much like we did at the beginning of the pandemic with all the cancellations and rebookings. So infusing AI capabilities into call center technologies so that you can get through a process quickly and get to an agent who's very targeted to answer your specific question. That's another technology that has floated to the top. Next, I'll talk about data modeling. You think about all the different aspects of the travel processes, whether it's data modeling for revenue management and pricing or capacity planning, or even for forecasting corporate travel. Behavior has changed so significantly, you really need to set a reset button on all of your data modeling. You really can't rely on any of that historic data because not only has the traveler's behavior changed, it's going to evolve very quickly. And as we see people get comfortable with vaccinations and what's happening country by country with variants and breakthrough infections, the behavior is going to change so rapidly and be so fluid, you can't wait 6 months to identify a trend to impact your forecast. So you've got to use AI tactics with your data modeling and be able to quickly identify a trend with machine learning and affect a change and take action on that trend that you're spotting. So that's another area that we're doing a lot of work. And I think everybody needs to really think about their data modeling tactics. And then lastly, of course, playing on the theme that Dr. Dow talked about, digital health credentials. We've seen a lot of new technology this past year around digital health credentials. We've got the IBM Digital Health Pass out there. IATA has a travel pass out there. You see the EU digital credentials all being rolled out this month for travel across EU borders. Having this health credential, verifiable, authenticated credential in digital form can really help all these processes. In the month of June, we saw a record number of delays and cancellations. Many of the delays were because of international travelers getting all the way to the gate with a paper health credential that wasn't the right test, wasn't the right credential for the destination they were going to. And so as long as we're relying on paper health credentials, not only do you have the confusion for the traveler, you have the confusion for airline employees, hotel employees who have to look at that credential and authenticate whether that's real or not. They're not health professionals. They're travel professionals. They're not used to looking at medical documentation. And as you start getting travelers from various countries, every country, the format of that test credential could be different depending on what clinic you go to or what medical office you go to get that test result or your vaccine. So getting to standardized digital health credentials is going to be very important for keeping delays down, keeping lines down, and keeping travelers moving through the process. So that's going to be a really big focus coming out of the pandemic, and especially for business travelers, is making sure you have the right digital health credential for your travel.
Mm-hmm. Yeah, I mean, the common theme of all of that is technology. It's such a balance between the personal side of business travel and how we can leverage that technology and all those great points you just mentioned. So the health passport aspect of it, Greg, has a lot of attention right now. How far off do you think we are globally to some kind of consistent model around that?
So I think we're at a critical turning point right now with the EU launching a standard across their 27 countries with their digital credential that they're rolling out right now. All EU countries have to have that in place by the end of July. August 12th is what the Parliament is telling them is the drop dead date. So that is really driving the rest of the world to quickly adopt these digital standards. You have several platforms out there around the world. And so everybody has their own network of credentials, and that's made it a little confusing. But what's also changing right now, in addition to the EU credentials, is we now have everybody shifting to VCI standards, vaccination card standards, or you'll hear them referred to as smart health passports. So there's finally a standard that everybody is starting to adopt, that all the verifiers should be able to verify off that standard. So that's also coming into play right now. So those standards went into place in June. So all of the verifier applications and all the platforms right now are starting to adapt to be able to verify a credential issued with the VCI smart card standards. So that's going to really change things. So with the EU credentials being standardized across Europe, and many others starting to issue with the VCI standards, that's going to bring us down to a fewer number of standards that we have to adapt to. So just making sure you have one of those QR codes, whether it's from the EU standard or the VCI standard, is really going to help you through the process. We've seen most major airlines started adapting to verifier applications, either using a third-party digital wallet or having something embedded in their existing passenger digital experience through their own apps. So just all that coming together is going to really simplify the process going forward and hopefully start getting some of these lines down to manageable levels at the airports.
Mm-hmm. Yeah, it's happened actually quite quickly when you think about it, from the start of the talk of having this kind of digital footprint when you travel to today. Yeah, it happened happen faster than some things in our industry. So it's really encouraging to see that, and I think it's critical as people get back out on the road. So in the spirit of everyone who's joining us today, would love your insight. And you think about the community on the phone. What does this all mean for the buying community and the supplier community? What can they do with all this information?
Yeah, I think the role that travel management companies and corporate travel departments play in this process is going to be really important. And I do see the role evolving and changing. This is all new. And as people get back to business travel, for many of them, it'll be the first trip they've taken in 15 to 18 months, because most of the leisure travel has been a lot of road trips up until this summer. And so I think just really helping them plan, really helping them manage expectations for what to expect when they get to the airport, when they get to a hotel, especially if they're crossing borders into another country. There's a lot of new things to manage to. You've got to understand the entry rules. You've got to understand exactly what type of vaccine and or test credentials you need to have. Some countries, even if you have a digital health passport, some countries are still requiring you to bring a paper copy because they want to keep a paper copy. So really understanding what the requirements are is going to be critically important. So travel planners, travel managers, I think getting resources out there to really help your travels be prepared for that is going to be critically important. I think there's a whole new service model to be developed around this. If you can have tools out there for your business travelers to know not only what is needed, but where can I go in my zip code or postal code to get the right test? How can I make sure I'm going to go somewhere that has a service level that can get the test turned around in time for my flight? I can't tell you the number of people I've heard from that thought they were doing all the right things, but then didn't get their test result back in time for their flight, because it's got to be within that 72-hour window, and not all the labs are meeting that service level requirement. So I think there's a real service model that can be built around this for corporate travel, because I think business travelers especially have to really understand what's going to be required for them, not only to get to their destination, but to get back home as well. And you've heard stories about people traveling somewhere across borders, and then the rules change while they're gone and they have trouble getting back. So things are still so fluid right now that having a travel counselor who's really managing expectation and pushing you information to know what to expect and what to be prepared for, I think that's going to be critical. Now, hopefully by September, we're going to start seeing things kind of settle in place with these EU credentials going in place, and more countries, we're seeing them finally lock into what their requirements are going to be. And I think as vaccinations get further along in more countries, we're going to see vaccination results being what countries rely on more so than test results. And hopefully we'll start seeing countries include in their rules mitigating that need for a test and relying specifically on your vaccination result. So I think we're going to see that shift coming in this fall if things calm down with some of these variants. And as we see more and more countries, like Suzanne referenced the Canadian rules that were just mentioned yesterday, I think we're seeing more and more countries really lock in to what their entry rules and exit rules are going to be.
Yeah, and the buying community and the supplier community have such an opportunity here to work together so closely to just at the end of the day make this easier for those travelers. It sounds like there's going to be a lot more prep involved with travel, a little bit more lead time. There's just so many nuances right now to think about before you get back on the road. But I'm really excited for that and for travelers to get back out there. So when you think about the supplier community, right, you're talking about possibly a new service model. Is there anything else from the technology side the supplier community can do to help the travel managers out there maneuver this?
Yeah, so you've seen a lot of the major airlines have started putting some really good resources online, both in their mobile app as well as in their web apps. And I think, for your preferred suppliers that you're working with as a company, really make sure you know where those links are. Make sure you're amplifying those links out to your travelers, because I'm seeing the travel suppliers really do a great job stepping up and really giving very explicit information about what's needed. Now, for a lot of them, until you actually have a booking with them, you can't get to some of these resources. So they're not easy to find and they're not openly available. So I think the more that we can make that information openly available, even when somebody's in the shopping process for a trip, just gives them more advance notice as to what they're going to need as they prepare for that trip. You know, business travel is quite different, as we all know. You're thinking about so many other things, what meetings you have to prepare for, if you're going to a conference, what your agenda it looks like and where you need to be at certain times. So I think just anything we can do, both as travel planners as well as suppliers, I think make that information out there, make sure there are links that it's easy to get to. But I'm really starting to see suppliers do a really nice job of making this information readily available down to the country level. And more of them are starting to put resources in place as well, where they'll even help you find a test facility close to you or very explicit information. We are starting to see some airlines offer options to actually upload a PDF of your vaccination card and actually maintain it as part of your profile. So start thinking of this kind of like your document verification process for a passport or a visa. Now you need to start thinking about, you got to have the right passport, you've got to have the right visa, and you've got to have the right health credential. So you've got to have all those in digital form and uploaded. And in many cases, airlines are starting to require that all of that information is available and uploaded in your profile before you'll even be allowed to generate a mobile boarding pass. You know, we're so used to getting that message, airport check-in required. It's typically because your documents can't be verified digitally. You're going to see more and more airlines push for that, for this health credential as well, because they just can't afford to keep having the bottlenecks at the airport, because people show up at the airport without the proper health credential. So anything to get any of that done in advance is going to really be helpful.
Planning will be key. Patience, as Dr. Dow spoke about, right? There's just nuances none of us have really ever gone through before that will now be introduced. So I think that's important as well. Before we close out, we actually have a question in the Q&A, Greg, if you know this. So the attendee, I live in France and have had both vaccines in France and had the EU passport. Can I enter the UK with this vaccine passport?
You can, but you've got to register it through the NHS mobile app or website. So even though we've got full interoperability with the EU passports across the 27 EU countries, the UK is not part of that. So what you need to do is NHS in the UK have both a website and a mobile app to manage inbound travelers to the UK. So go register yourself in that mobile app or that website. You should be able to upload your vaccine credential from your EU passport into that application, and it will register it with the NHS so that you can then use it through that NHS mobile app when you enter the UK. So we're trying to get to full interoperability between countries where there are proprietary systems like that. So that's one of those points of interoperability.
Yeah, thank you, Greg. Great advice. And it's just such a pleasure to always speak with you. Incredible insight and recommendations for our audience. And just thank you, Greg, for your time today.
No, happy to be here.
All right, Jill, I'm going to turn it back to you. Thank you very much.